I was really, really intrigued by an article by Betsy McCoy in the New York Post. She says, don't fear this coronavirus spike. Wear your mask, she said. Watch the real measures. Hospitals are ready for an influx of patients. And they've learned, doctors, medical professionals have learned of the deadly risks, the advantages. They have at least one medication, remdesivir, to lessen the disease's severity. Fear. There's so much fear, and we get it, but it's been a real honor to tell you about flattenthefear.com. Our partners with Job Creators Network Foundation. I want to welcome to our conversation one of the MDs, one of the doctors. This is one of the lead physicians on the development and merger of multiple solo ENT practices. He's a very, very highly accomplished ear, nose, and throat doctor, Dr. Scott Hardeman, who joins us on our guest line to talk a little bit about this coronavirus challenge we're all facing. Doctor, it's great to have you on the Mike Gallagher Show, sir. Thanks for joining us.
Thank you so much.
Let's talk a little bit about the spike that we are seeing. Betsy McCoy, former Lieutenant Governor of New York, she's very, very plugged into health matters. She says, listen, the media is sounding the alarm. She argues they're distorting the facts to cause panic instead of reporting the whole truth. Am I crazy to wonder why in all the reporting of coronavirus cases that we're seeing, there's not really a lot of emphasis placed on actual hospitalizations and deaths? Is that a reasonable expectation, or is that distracting?
Well, no, I think it is a reasonable expectation, and those are the metrics that we need to be most concerned with at this point. It stands to reason, obviously, as the country starts to crawl out of this and open up and people start to congregate more, as well as an increase in testing capacity, that we're going to see more cases. Many of the spikes or increase in cases that we're seeing in certain parts of the country have not experienced those before, and so there's a natural sort of progression and evolution as different illnesses move through society. But looking at the raw numbers of cases is what gets put in the media a lot. It gets written about a lot, and in reality, we should be focusing attention on hospitalizations, ICU admissions, death rate, which those are continuing to flatten and or decline across the country. And so this is not unexpected to see that, and I just don't think you can take it in that one slice. You have to be a little more thorough in the analysis of the data to really get a feel for where we are.
And we've all become sort of consumed with data. That's why, again, flattenthefear.com. I want everybody to go to this site. These new Florida numbers, for example, have just been released a few minutes ago. 8,942 new cases were detected yesterday, according to something I just saw online. Of course, that's way higher than the previous day of 5,500. But then I saw, buried in the story, almost as an afterthought, hospital admissions. 212 yesterday versus 197 the same day 7 days ago. So again, a lot of data, but Doctor, I'm trying to understand something. How could there be such a huge number, and 8,942 new cases is big, with a couple of hundred hospitalizations?
Great. Well, it's a great question, and I think it really speaks to the expansion of the testing capacity. So in most parts of the country, as medical procedures increase and outpatient surgery resumes, there generally is fairly broad-based testing for people that are asymptomatic as a screening tool. In my state, they've opened testing up to anyone that wants a test. And so it just stands to reason, as you increase the capacity of testing, you're going to find more people who have the virus or had at least been exposed to the virus at some point as well. So admissions, I think, are a very important key, because when we originally started the flatten the curve concept, it was to not flatten this out of existence. You can't flatten nature out of existence. It's going to run its course. We just want to not overwhelm the healthcare system. And we successfully did that across the country. But as we test more and identify more cases, those are largely people that are younger now. This illness has sort of progressed through, and it's declared itself that it tends to hit harder against the older individuals or those that are infirmed with other comorbid or health-related issues. So you absolutely will see an increase in number of cases. Fortunately, they're younger individuals. The mortality rate is exceedingly low in that group, and based upon the steady or declining numbers of hospital admissions, it speaks to the fact that the illness is nowhere near as severe in folks that are 50 years of age and under, too.
As we look at the hospitalization and even more importantly, the death rate, the mortality rate in America, consider this, and I saw this yesterday, and I was just blown away by the CDC director, Dr. Robert Redfield, who told reporters, our best estimate right now is that there are really as many as 20 million more Americans who have contracted the virus than are reported. If that's the case, again, I'm a simple guy. I'm a big mouth on the radio. But let me ask a medical doctor. If it's true that over 20 million people are infected, where we really think it's whatever 2.8 or 3 million, whatever it is right now currently, doesn't that change the mortality rate, the death rate dramatically?
Well, the death mortality rate, the CDC revised their numbers down to 0.4%. So it's definitely not a foregone conclusion that seeing more cases will equate to a percentage increase in mortality. More deaths, yes, obviously that can happen, but it doesn't seem necessarily to be the case at this point. The numbers are continuing to decline, largely because the cases that they're picking up now are, again, asymptomatic or very mild symptoms that are not requiring hospitalization. This illness is universally not fatal. 80% roughly of people have minimal to no symptoms, and another 10 to 15% get fairly sick, and 5% get really, really sick with it. But that tends to be in the population that I had mentioned, the older or more infirmed group of individuals. So the numbers that he was quoting yesterday, to some degree, if this thing is ultimately going to go away versus learning to live with that, we need to reach some level of herd immunity. So he was referring not just to potential active cases or potentially asymptomatic cases that are testing positive now, but also based upon antibody testing. And out of New York City, I believe it was in different regions, it was thought to be on antibody testing, 10 to as much as 25% of the population had antibodies based upon random screening. There was a study out of California that had similar numbers like that as well. So again, you have to break it down a little bit and say, are these folks who've had it in the past or fully recovered or didn't even know they had it and show antibody levels that indicate that at one point they were exposed and contracted the virus? Are they active cases where they're acutely ill, or are they testing positive and are asymptomatic and really pose very little risk for transmissibility if they're using some common sense measures and isolating a bit and then retesting down the road?
Dr. Scott Hardeman is our guest. He's one of the physicians involved in the campaign to flatten the fear, flattenthefear.com. This is a project of the Job Creators Network Foundation. He is chairman of the St. Louis Physician Alliance. And I just appreciate you taking time out of your busy schedule, because everybody is just so focused on where we go. Let's talk a little bit about the risk in general to Floridians, to New Yorkers, to Texans, to Ohioans, to Americans. And what are you telling your patients in terms of the days and weeks and months to come? I mean, my doctor and I put together a plan. I'm kind of proud, brag on myself. I've lost about 43 pounds since February. I've been exercising. I've been eating much better. I'm taking care of myself. I'm trying to boost my immune system. And I'm being cautious. I'm trying to stay away from crowds of people. I am wearing a mask when I go to the grocery store or the pharmacy. I'm trying to be sensible. How about your advice, doctor, to your patients, to anybody who asks you, how do we navigate these choppy waters?
Well, those are all great points. I think there's an element of personal responsibility here that if we're cognizant of contact with individuals that are acutely ill or seem to be manifesting symptoms and try and distance in that regard, that lessens the transmission chains quite a bit. Significant hand washing and really being conscious of personal hygiene, mask wearing in certain circumstances, obviously, if you can't social distance, makes a lot of sense. I view this now as at least in my part of the country, where we've definitely kind of gotten over the hump. We expect to see some cases, the number of cases increase, but we've been open here now for about 4 weeks or so and continuing to expand, and are not seeing anything except a continued decline in hospital admissions and deaths as well. So I think it's wise for people to be cognizant of going forward. I think we need to be aware to protect our most vulnerable in our society, those that are older and those that have other health-related issues or immune issues that potentially could make them more susceptible to this. But we also have to understand that when the fear kicks in, we do things like shut down society, shut down elective medical procedures, and people who don't have COVID suffer tremendously with this. So it has to be a little more targeted. We're in a completely different place today as people talk about having a, quote, second wave or a new spike in this. We've got very broad testing capacity to the point that within, a day's time or less, someone can get tested almost anywhere in this country and have results very quickly. That makes a lot of difference because you can quickly isolate pockets of places where this seems to be peaking, and again, protect those in nursing homes or assisted living facilities or those at home that have, that are elderly or have other health-related issues. So I'm not in a panic mode on it at all. I think it's a manageable illness at this point. We need to be aware of it, but we need to try and be conscious of not spooking society to the point that we back off and cause or inflict harm in other sectors as well, not just in medicine, but, in the small business owners. It's one thing to shut down a country for 30 days and, people can kind of live like that, but it starts to hurt people financially after 6 or 8 weeks of that. And that can't be ignored, just like you can't ignore their health-related issues either.
Absolutely. Dr. Hardeman, I'm so grateful for your time today. Thank you very much for helping us and being part of this Flatten the Fear project with the Job Creators Network Foundation. All the best, sir.
Thank you so much. You have a great day.
You too. Flattenthefear.com, Dr. Scott Hardeman.